Uh, this subject is emotional, and we tend not to really cover it very well. Um, I just want to tell you a story about one of my patients who came in. She was in her late 20s, young female with severe alopecia areata. And when she came in, she said, I have tried so many things. I have tried all sorts of treatments you can imagine. And I heard that there is something new to treat alopecia areata. And I said, okay, let's discuss. So we started talking about, one of the newer treatments, and we started discussing systemic side effects that might arise from there. And after explaining everything in terms of malignancies, clots, she stopped me, actually. She interrupted me and she said, will that grow my hair? And I said, well, you have a very good chance of growing your hair on that medication. And what she said was shocking. I have to say this in Arabic. يعني قالتها بالحرف الواحد: لو هذا العلاج بيعطيني 5 سنوات بشعر، I don't care لو حياخذني لمقبرة النسيم. She said this, and I'm quoting her words. So, and I think we should, I'm always considering the psychological impact of this disease, but I think we need to do more in that regard. I think we have to really look into the psychology of our patients and to support them emotionally. I have nothing to disclose in regard to the content of this presentation. And when we talk about the treatment of alopecia areata, I think most of us in the clinic will concentrate on the left side. We'll concentrate on the physical look, on the hair regrowth, on how to treat the symptoms. But we don't really, or not necessarily, we cover the psychosocial impact and the emotional impact of the disease. We know that this disease has, a significant impact on relationship, on work, on studies, on marriage, social relationship. It's so complicated for those patients with severe alopecia areata. So, and these are the things that I would like to discuss. You know that there is a very good chance for a patient with severe alopecia areata to have a significant psychological impact. Patients, when they have severe alopecia areata, they always say that their life has changed. And sometimes they tell you that my life has changed indefinitely. It can affect self-perception, self-esteem, personal relationships, unemployment, and suicidal ideation is high in those patients. And I will show you something else in the upcoming slides. Self-esteem and confidence and their ability to go out, to reach out to the world and interact with other people also is affected. So patients with severe alopecia areata, especially chronic ones, severe ones, they're feeling helpless. They are isolated, and they have what they describe when they lose their hair is that they are describing it as if you are losing a limb or you are losing a part of your body. So that is really significant. And as I said earlier in this talk, this is emotion, and I'm going to show you a lot of their emotions. I'm going to show you a lot of their words and what they describe and how they feel. And I think this is very important for us to digest and understand. So they feel guilty about their feelings. So they have this negative impact. They have this negative impression, and they feel guilty about it. So that is even doubles to their stress and to their anxiety. When they lose, especially when they lose a lot of hair in a short period of time, this is shocking for them, and they describe this as disturbing their identity. And it is, we know that especially severe alopecia areata is a devastating disease. Stigma, many of them, they would describe being verbally abused, bullied, shunned, stared at. But look at what other people think when they look about images of patients who have alopecia areata. So around 28% will describe or will they think that this patient has a medical condition or has a medical disease. And 17% will think that that person is unattractive. And 7% would avoid even interaction with those or physical contact with those patients. And we hear this a lot in our clinic from our alopecia areata patient and vitiligo patient, is that people are avoiding them. They don't want to touch them. They don't want to come into contact with them. Look at this. I will give you a minute to read which one you would like. But I'll just quote some of them. One of the patients mentioned that you would not feel it or you would not appreciate the burden of this until you have this disease or until you have someone close to have this disease. And that is true. That is actually, I have witnessed this in life. Some patients have mentioned this several times. And this is, I would probably say this quote for whoever says, oh, this is a hair disease, just wear a wig. That is something very disturbing to hear for the patients and whoever taking care of the patients. Look at the other patients. She said, the more hair I lose, the more I die inside. Very touching. It's very hard to hear those words from those patients. And look at this, the grandmother. She said that I'm afraid to hold my grandson. I'm afraid that I'll get exposed. I'm afraid that he will pull my scarf or he will do something. So we should understand that this changes the lives of our patients. So this is something that, yes, it doesn't kill. Hair fall doesn't kill, but indirectly, mortality can increase. And this is in Korean patients. Mortality risk was up to twofold higher in those patients with alopecia areata, especially younger patients who are less than 25 years. Mortality risk of breast cancer, we don't say that alopecia areata will cause lung cancer, but those patients are under stress, they usually smoke, and there is a slightly increased risk of lung cancer in those patients. And this is, again, for whoever says that hair it is just hair. You can't just buy a wig and put on a wig. Wigs are not ideal. Hair replacement is not ideal. It's difficult. First, it's difficult to find a good wig, a naturally looking wig. The routine of the hair wig is not very easy. Patients, especially if those are the ones that you need to remove and put on daily basis. And all the patients, they always, when they are out in the outside world, they are afraid that it will be dislodged. Somebody will notice that I'm wearing a wig. And even some of them, they will think deep inside, they will feel guilty because they think that they are deceiving the person in front of them because they are hiding their disease. So yes, it is something that we can suggest for our patients, but definitely it's not ideal. Nothing is like their natural hair. So the disease burden is highly relevant. We always, when we make our decision on how to treat those patients, we think, okay, it's very mild disease, very severe disease, loss of full hair, but we should always integrate the psychological burden. And I think this is something that will be discussed later during the discussion of the guideline. You know that the burden of the disease is different. Some patients will be really bothered about a single patch, and some patients are okay with it. So it's not always the extent of the disease. So what we should really look into is how this disease is impacting the life of a patient, regardless of the extent of the disease or the hair loss. So there are several scores that have been discussed earlier, and they can be used, like DLQI, hospital anxiety and depression score. And I'm just going to show you quickly something about Skindex, just because of the short of, we don't have a lot of time to discuss all of these scores. So this Skindex 16 was adapted from the longer one, and it has 3 domains: symptoms, emotions, and functions. And what is what is the negative thing about skin disease and alopecia areata is that usually those patients, they don't have symptoms. So it doesn't hurt, it doesn't itch, it doesn't have, so their scoring might be actually lower, while actually the burden of the disease is higher. And this is what I'm talking about. If you look at the first four, is your scalp is itching? So most of the time they'll tell you no. Burning or stinging, nothing. Does it hurt? No. So they will get a lower score. But if you look at emotions, yes, it makes a big difference for those patients. And this is how the severity of alopecia areata will affect their score. So you look at first. I'll talk into two different things. The first thing, which domain is mostly affected? It's the emotions. So you can clearly say that on the left side, the emotions are the highly affected domain of the score, while the symptoms is the lowest. And when you look at severe in gray, so you see, look at the functional and symptoms part. So when you look at the severe alopecia areata patients, they might affect the patients in these two domains as high as double the amount of mild alopecia areata. So there is a correlation between the severity of the disease and how it affects those patients, but this is not a linear, continuous line. So I'll show you this in this curve. So you can see that. Look at the one in the blue, because this is what matters to us actually, is the highly affected domain of the score. So you can see that moderate and large area, they have the scores are higher than the one who have totalis universalis. And that might be surprising, because most of the skin diseases like atopic dermatitis, psoriasis, the worse the disease is, the worse would be the psychological impact on the disease. But there is an explanation for that. So what can be an explanation is that those patients who have complete hair loss, because sometimes if somebody has if the patient lost 50 or 60% of his or her hair, they will care about how to hide the part. But if they lost all of their hair, they usually manage to cover the whole area. So and usually those patients, especially if they have, because those patients who have improvement in the score are usually the one who have a chronic disease. So they have the disease for a long period of time. This probably doesn't apply for somebody who lost all of his or her hair within a short period of time. So they usually cope up with the disease, and they usually, especially if they tried several medications and they have failed, and that is probably the case in those patients with severe alopecia areata, usually they just tolerate and they just adapt to the new condition, and they don't have the same as if they have it to start with. So what are the factors that contribute to the psychosocial impact? Logic. Younger patients usually are affected worse than the older patients. Female patients usually more likely to report problems, especially at work. And patients who have alopecia areata, probably they are less depressed, but they have higher anxiety scores. And patients with moderate or large area, usually those patients who have moderate or large surface areas are worse than the one who have totalis or universalis for a long period of time. So conclusions. So the impact of this disease definitely is highest on the emotional and psychosocial domain of the any score that we use. And usually those patients have higher anxiety scores. Their self-esteem, usually those patients have a lower self-esteem and self-worth perception. And just as I show you in the graph, it's not like any other dermatological disease. Usually the chronic severe one might actually cope better than the one who just had the disease. And the quality of life, and I think that is the most important thing, the quality of life of those patients should be considered and should be incorporated. And we should not care only about like SALT score or the extent of the disease. And I think to measure the the emotional and the psychological impact of the disease, we don't have a perfect score yet. I think we should develop or we should work on developing a better score. And then with that, I thank you very much for your attention.